Hi there. Good afternoon, everyone. Welcome. We'll get started here in just a second as we let everyone load in. All right, great. Welcome. And thank you all so much for being here for our May Arizona Community Grand Rounds. This is on social determinants of health connections with community cares. I'm really excited to dive into today's session and hear from our fantastic experts. First, I'd like to extend a big thank you to our partner, the NARBA Institute, who is instrumental in making Arizona Community Grand Rounds possible. And of course, to Mary Jo Gregory, Dr. Mark Carroll, Carla Berg, and Jennifer Pierce, who helped make all of this happen in front and behind the scenes as well. Please make sure that you stay to the end. At the conclusion of this presentation is when you'll see the information about how to obtain continuing education units for your participation. Now it's my pleasure to introduce our speaker panel. I'm going to provide a very abbreviated summary of their very impressive bios. So first we'll hear from Kelly McGann. Kelly McGann is the Director for Social Determinants of Health at Contexture, overseeing SDOH programming across both Colorado and Arizona. Kelly has years of experience in both health and human services and community-based organization environments, promoting equitable access to health and social care. Next, I'd like to welcome Julia Soto. Julia joined Phoenix Children's in November of 2012 and serves as the Administrative Director of the Phoenix Children's Medical Group, overseeing divisions of psychiatry, psychology, mental health therapy, primary complex care and adolescent medicine, palliative care, the child protection team, homeless youth outreach, and the Center for Resiliency and Wellbeing. In addition to many other leadership roles within PCH, Julia leads key strategic initiatives like universal screening for SDOH, care coordination and navigation, and abuse and neglect prevention efforts. And Julia is joined by a special guest, Sam Pearson, who's a care navigator at Phoenix Children's. Finally, we're pleased to have Karen Brown with us. Karen Brown is the Director of Strategic Initiatives at A New Leaf. And over the course of her 27 years, she's been involved in both direct service and administration in the areas of philanthropy, domestic violence, homelessness, workforce services, and economic development. Karen led an internal A New Leaf task force to address social determinants of health by participating in the community information sessions with Access, and was part of the larger task force that selected a technology vendor for the closed loop referral system that we're going to talk about today. Karen's role on the implementation of CommunityCares at A New Leaf is focused on the human side of change management. So now it's my pleasure to turn the floor over to these talented individuals to share more information about what CommunityCares is, how it can be used by providers and community-based organizations to support SDOH services. Throughout the presentation, please feel free to use the Q&A function to send questions our way. After each of our presenters provides their initial comments, we'll dive into all that discussion, and I'd love to pull out your questions from the Q&A to put forward to our presenters. All right, Kelly, I'll pass it over to you first to give us some background on CommunityCares. Thank you.
All right. Thank you, everyone, and thanks for the opportunity to come here and share a little bit of information about the CommunityCares program today. Also, thank you to CommunityCares partners, Phoenix Children's and A New Leaf, for joining and sharing their experience as well. Next slide, please. All right, so today we are going to be doing just a quick overview of the CommunityCares program. I will dive into the benefits and the functionality, share a little bit from a partner, even though you will get to hear from some partners later on today as well. And then I apologize, we do not have time to do a demonstration today, so we'll invite you to a demonstration at the end if you would like to see a platform demo. Next slide, please. And again, one more slide. Thank you. So CommunityCares was really born out of Access's Whole Person Care Initiative, which began in 2019 with the goal of identifying social risk factors and then providing an intervention and connection to resources through a referral system. Next slide, please. CommunityCares is Arizona's statewide closed loop referral system that it really enables the exchange of social care data across sectors, across providers and different organizations, really on one unifying statewide technology solution. The goal is to streamline the sending and receiving of referrals and allow providers to track outcomes for their patients in terms of if they were able to access the resources and other social care needs that they have identified. Next slide, please. CommunityCares is really a true partnership between so many partners. Here you can see that Access is the funder and provides oversight to the direction of the CommunityCares platform. Contexture, we oversee implementation as well as the guidance, and really are responsible for the statewide rollout of the program and the success of the program. We partner with Unite Us as the technology vendor and platform that powers the CommunityCares program. And then we also partner with Solari Crisis and Human Services, who support engagement and outreach with our community-based organizations, as well as maintaining the full up-to-date statewide resource directory, which is fully ingested into the CommunityCares platform. Next slide. The goals of CommunityCares are really to support and enhance care coordination, to connect Arizona communities across sectors with the goal of improving health outcomes, focusing on whole person care. We also use a data-driven approach to help inform program direction, to help us do targeted outreach, and really to support our partner organizations to utilize the data that they have access to as well. Next slide. As a participant of CommunityCares, you have access to connect with providers, as I mentioned, across sectors. So we have healthcare organizations, we have community-based organizations, churches, government entities, schools, all are able to and are participating within CommunityCares. By logging into the CommunityCares platform, you will have access to screenings and assessments to really help your team identify the social care needs of the folks that you are working with. Those screeners can then help inform the referrals, and then through the system, you can electronically send all of the referral information as well as demographic information directly to the organization who provides the services. This streamlined approach really takes the onus off of the patient or the client in accessing those resources, and minimizes the number of times that they have to share their story. Additionally, as I mentioned earlier, it's a closed loop referral system. And so what that means is that as a provider, you will receive confirmation when those social services are delivered for your patients. Through our partnership with Solari, you will have access to the full statewide resource directory. And then, as I mentioned, you also will have access to data tracking and analytics through the platform and through another Tableau dashboard feature that is included within CommunityCares. Next slide. So while CommunityCares is a free program for participation, to access and utilize the full platform, there are also incentives offered for participation. So through our partnership with Access, we support the differential adjusted payment program, and we support the SDOH DAP providers in meeting their milestones for the DAP program. By meeting these milestones, they receive a percentage adjustment to their reimbursement rates. For the SDOH DAP program, the milestones include utilizing CommunityCares to identify the social care needs through those screenings and assessments, and then sending closed loop referrals directly within the system. Additionally, CommunityCares offers CBO programs where organizations can receive up to $17,000 for participating in the Milestone Incentive Program and opting in to receive referrals utilizing CommunityCares. And then additionally, there is technology assistance funding, which supports technology needs and staff training time for our CBO partners. Next slide. So like I mentioned, we like to share some participant experience. And so here, our partners at Women's Health Innovations really felt supported by having a resource to connect their patients to basic needs so that they can focus on providing the healthcare services that they offer. But again, you'll hear from some of our partners later on today. Next slide. I wanted to share some of our achievements. So while we are only about a year and a quarter into the implementation of CommunityCares, we have, as of the beginning of this month, we have more than 1,000 organizations live and utilizing CommunityCares. From those 1,000 organizations, they are offering more than 2,000 programs focused on addressing the social determinants of health. We've seen more than 20,000 referrals sent through the CommunityCares platform for more than 14,000 Arizonans. And so we're really excited to share these achievements, so we know we have a lot of work to continue to do as well. Next slide, please. As I mentioned earlier, as a participant of CommunityCares, you have access to data tracking and analytics. And there are two different products that are available through CommunityCares. Through the platform, you will be able to export client level data and really see all of the row level information of the activity of your organization. So all of the client level information on referrals and screeners and cases that your organization has participated in. Additionally, all participating organizations have access to a Insights Tableau dashboard, which allows you again to track your organizational activity, but then it allows you to look at statewide and community level information. So you can really, drive into all of the gaps in resources. You can look at health equity information, demographic information, and really understand what are the top needs and resources that are being requested within your community or statewide. Next slide, please. As I mentioned earlier, we are seeing significant growth in onboarding and utilization really since the beginning of 2023, where we now have more than 1,000 organizations live. And we're seeing the trend in referral sending increase month over month, where currently we're seeing about 4,000 referrals sent using CommunityCares each month. We are also focusing not only on engagement across the state, but really in identifying barriers to adoption, understanding user experiences, identifying ways that we can streamline the process. And so feedback from community members and partners is really important to us. From community feedback, we identified opportunities to really streamline and increase the CBO programs I mentioned earlier by offering more incentives to our CBO partners, and also adjusting the milestones to offer alternative milestones for our housing and food assistance organizations, knowing that those are the top 2 requested service types across Arizona. Due to the data we're seeing, we are also really targeting those top requested service types. And so really focusing in on how we can better engage with food pantries and food assistance organizations, as well as housing related programs. We know that CBOs are really at capacity, and need ongoing resources. And so we are working with CBOs to identify how can community cares support their efforts in really showing the impact of their programs, showing all of the data to support all of the program activity that they are providing and the impact that they have in the community to really identify ongoing resourcing for our CBOs. Next slide, please. All right. And so as I mentioned earlier, we didn't have time to do a full platform demonstration for you today, but I would love to invite you to one of our Community Cares information sessions if you would like to see the platform in action. You can also email us at communitycares@contexture.org. As I mentioned, feedback is really important to us to understand how we can better improve and streamline the program. So with that, I will go ahead and pass it back to Jessica.
Thank you so much, Kelly, for that information. As a reminder for all our attendees, you can put any questions you have in the Q&A, and we'll get to them at the end. And just a really great overview, though, of the system, and incredible to see 4,000 referrals in March. So thank you for sharing that. Julia, I'll turn it over to you now.
Thank you. And thanks, Kelly. That was a great overview. So I just wanted to say hello and thank you so much for the opportunity to really share about the unique work that we are doing regarding social determinants of health at Phoenix Children's, and really the pleasure of being among our friends at CommunityCares and a new lead for our longtime partners. So we appreciate this amazing opportunity. Next slide, please. And before that, I will have an extra special introduction to our amazing Samantha Pearson a little bit later when we highlight her work regarding social determinants of health. But Sam Pearson comes to us from a really amazing background. She worked at a Title I school in Southern Arizona as a teacher for quite some time, so really has done a lot of significant face-to-face work with children and families that are experiencing social determinant of health needs. So we were so pleased to hire her as part of this team and our very first care navigator solely dedicated to this work. But I think most of us are pretty aware that social determinants of health are really primarily non-medical factors that can positively or negatively affect health outcomes. Slide, please. So the intent of our presentation today is to really share what we've done at Phoenix Children's over the past year and a half, and where we hope to continue to go from here. So in October of 2022, Phoenix Children's did decide to begin universally screening for social determinants of health across our entire health system. So regardless of any entryway to Phoenix Children's, whether that be emergency care, or urgent care, inpatient, surgical practices, primary care, we universally decided to screen all patients and their families for these particular needs. And they were screened every 6 months. This was strategic in that we would like to really see change over time. So we've created some data collection touch points, and as we start to resource families, we would love to be able to see the decline of social determinant of health needs as we work to implement programs to address these. So our phase 1 goals were really to learn from our patients. What were they experiencing, so we can help them drive what resources and what we develop to meet their needs. So we began screening and connecting patients directly to 211 based off of their text message survey. So I skipped up here above we were leveraging a technology that Phoenix Children's uses to collect other information. So patient ID, caregiver insurance information. We leverage that same technology to do this screening en masse. Next slide, please. Thank you. So this is what the screening tool looks like on a patient's cell phone or email. So it comes through really patient and family friendly. In addition to these 6 different questions, we added 3 additional questions related to financial security, legal services, and interpersonal relationships. We decided, because our audience really are children, to steer clear of the domestic violence related questions, but really look at interpersonal relationships in terms of bullying. If parents are concerned of their children either being bullied or potentially being the bullier, and then how do we address those needs? Next slide, please. Thank you. So in our first full calendar year of screening, we surveyed over 175,000 patients for social determinant of health needs. 17% of the patient population that responded had at least one social determinant of health need. So this is a huge, huge piece of our community. And across universally, access to safe and affordable childcare, access to mental health resources, and food insecurity were the top three identified needs across every area of the hospital. Since we started screening back in October of 2020, we've screened over nearly 260,000 patients through over 350,000 visits. So that's where we're seeing that number of visits really start to exponentially increase as we're doing these screenings every 6 months. So out of that number, that 200,000 patients, 53,000 have identified with at least one social determinant of health needs. That's almost 20% of our patient population when we look at from the start of our screening till now. Next screen, please. And so that text message that goes out to patients and families automatically gets scored, and results flow directly back to this custom Power BI dashboard that really allows us to review at a system level, to really to be able to scope out and start to scope in on areas of the hospital, different divisions and specialties, all the way down to the patient level. So it's pretty amazing. This is what we, Samantha and I, and our team use to really look at what patients and families are telling us and start to make decisions of what's in our wheelhouse, what can we actually do, what do we have control over, and how then do we partner with the community to meet these needs that patients and families are so bravely sharing. Our next steps. We have a whole lot of data. We have a whole lot of personal information that families are sharing with us. And so we moved into phase 2, next slide, please, which is really how do we address the need? We took a multi-pronged approach to really, as we were screening, collecting this data, simultaneously looking at how do we address the needs? And so how are we building partnerships to meet families where they are and helping them address the needs that they're sharing. So one of the first and most important partnership we really formed was when we partnered with Contexture through CommunityCares and got onto the Unite Us closed loop referral platform. That was tremendously helpful, and we'll go into a little bit more of the data that Samantha really is credited for achieving. And really, this was really important to us because we wanted to really advance past providing just the 201 general information via text message. So when families were initially getting the patient survey, based on their responses, they were automatically being sent links to 211 based off of their self-reported need. But we wanted to go beyond that, and that's really where CommunityCares stepped in. We also partnered with a mobile food pantry. So Phoenix Children's now has a partnership with a mobile food pantry that comes here to our Thomas campus. We also started to really look at this data that was so astonishing and have applied for and received IRB approval to start to do research on this, really using social determinants of health to identify patients that are at risk for child neglect and really assist in prevention. We also wanted to make sure that education and communication was a key focus of what we were doing. So a lot of that work has really been internally focused, so educating our providers, our care teams, frontline staff, and then communicating also to our board of directors, communicating to all employees through our State of the Health System annual address. We've been reporting very closely to our physician leaders and operational leaders on this work and where we need to move forward. We also applied for and we're honored to be selected as one of Access Targeted Investment 2.0 5-year quality improvement initiative. So really exciting movement in terms of that. And also, as Kelly shared, really the Access's DAP payment was what allowed us to really think through, move the needle on this, because we were able to use that differential adjusted payment to hire Sam Pearson and to begin to really look at what are we doing as a system, how do we fund it, how do we make it sustainable. So that DAP funding was really, really beneficial to us. Next slide, please. So this is the amazing work of our Samantha Larson, or excuse me, Samantha Pearson here on the call. So she solely has completed all this work on behalf of Phoenix Children. So again, using the DAP payments, we were able to hire Sam into this particular role. And she has started using and selecting patients that are most at risk, those that are reporting 8 or more social determinant of health needs, and prioritizing those. Also for patients and families that screened 8 or more social determinant of health needs, they automatically receive a text message allowing us to capture consent to refer to the Unitas platform. Based on that, Samantha then goes in and has served 537 patients and families through nearly 3,000 cases. So it's pretty spectacular. Next slide, please. And this is a breakdown of Samantha's first 7 months at Phoenix Children's and all the amazing work she has done. And so again, we called out that 537 unique patients and families that she has helped serve, and the referrals. So about half of those are outbound. So those are sending referrals directly to those already on the Unite Us platform, so already partnering. So directly being able to connect those. Yes, high fives for Sam for sure. And also what's really interesting and what's been so helpful is that in addition to this work, we meet monthly with Contexture to provide SDOH data directly from our patients and families on their own self-identified needs. So areas of opportunity that we see that can further enhance the network. And they also provide great technical support. And then we discuss potential partners, like who we really normally partner with, how can we start to target them to really help this closed loop referral system become more and more robust as we learn more and more from our patients and families in the community. So not only the use of the platform, but that ongoing intentional monthly meeting is really important, because as you see here on the screen, the out-of-network referrals is still pretty high. We're still finding lots of families tell us about their needs that are not quite onboarded. So I think that's really important for us to share what our families are telling us directly back with our partners, so they can be as intentional as we aim to be. We also wanted to take this brief 2 minutes of fame to really call out some exceptional partners that have been really superstars along the way, including the Korean Community Foundation, Confianza Health, Helping Families in Need, Mom's Pantry, and DNN Por Más y Más. Really amazing work. And this, by using the Unitas platform, it's been really amazing because so many times we often find that providers and caregivers do not want to ask these really hard questions because you don't know what to do with responses. And so by partnering with and using the Unitas platform, we've been able to alleviate so many of the provider and leaders' concerns and fears about asking these tough questions, because we have an opportunity now to truly connect our patients and families back with resources that meet their needs. And it also helps address that needs that can significantly impact a child's and family's ability to be healthy and well and achieve good medical outcomes, which is at the bottom line our mission to take care of children and families and support their overall health and wellness. Next slide, please. I'm going to share very quickly about some of the other work we've been doing here at Phoenix Children's in terms of internal resource development. Like I said, we've partnered with Activate Food Arizona's Farm Express Mobile Food Pantry that comes to our campus bi-weekly, has been really well utilized by our patients and families, and really offering the ability for our patients and families to have access to restaurant quality, farm to table, fresh, wonderful produce that they themselves can shop on board the mobile food pantry. We also, when we were asking about those interpersonal relationship questions about bullying, the needs were very high. We were seeing a lot of children responding back saying, yes, we have those needs. And there were not a lot of community resources out there to refer these patients to. So we have leveraged internal resources to build our own group therapy session to address bullying for our 11 to 14-year-olds. It's a very, very packed house. We are going to open up a session here at our Thomas campus as well, because that has been a really critical piece of us and our ability to heal, build, and strengthen build strategies for these children who are experiencing bullying. Next slide, please. We also continue to work on that dashboard and our data collection enhancement. That's really important as we're learning more and starting to really build our long-term strategy around how do we really check and see is what we're doing helping. We also have further partnered with our own Phoenix Children's Care Network, who does a lot of care navigation, care coordination for our children, especially those with medically complex needs. We also know that research, that having this information and data shouldn't be something that we just sit on and not share. So we are working towards research and sharing out some of our best practices. We also have some really interesting data coming out of our inpatient behavioral health unit and our outpatient developmental pediatrics surveys, looking at the unique needs of those children as well. And we also know that on my child abuse and prevention hat and work here at Phoenix Children's, we know that there's no validated tool for screening in ambulatory outpatient settings for abuse and neglect. And there's best practice in the community is that there's guidance that really using social determinant of health screening as a predictor of child maltreatment is maybe the avenue we as a community who are working to prevent abuse and neglect, both accidental and non-accidental in the community. So doing a lot of work in terms of how do we use this really powerful information to address potential abuse and neglect downstream. Next slide, please. I want to share just a teeny bit about our Target Investment 2.0 application. We did apply as a pediatric primary care focus. And so this is really to establish standards and criteria for screening for SDOH by patient populations and really respond well to elevated needs, which again, that comes back to our partnership with CommunityCares, making sure we have that really strong. Also, as we as a health system work to embed whole person care into the work we do every day, and defining those accountable persons and that reporting of information, that structure of information, how we report up to the board of directors and then down to all of our frontline volunteers. Also a heavy emphasis on access to behavioral health care in the primary care setting. Next slide, please. And our last, right, is that communication. How do we continue to advocate for children and families and use this powerful information to continue to work towards advocacy, work towards prevention, work towards community well-being. And I think that's it.
Thank you so much, Julia and Samantha, for all of your incredible work at Phoenix Children's. It's been wonderful to hear about that. And I love the point that you made, Julia, around it's not helpful to do social determinants of health screening if you don't have anything to do with the information. And so it's really great that we can come together and have this platform that continues to grow in order to have a place to refer our patients or members of the community to, and we do identify those needs. So thank you so much for that. Karen, I will turn it over to you. Thank you.
Thank you, Jessica. Hello, everyone. I really want to thank our partners and the opportunity to partner and share with you a little bit about a new leaf's participation and experience in the CommunityCares program. Next slide. A new leaf identified the need to focus on social determinants of health for housing and shelter programs prior to the start of this timeline that I'm sharing with you. When we opened our La Mesita campus's first phase of housing, which was in 2014, and by 2015, we saw a significant reduction in emergency calls from our clients being housed as we added more services on site. The La Mesita campus has affordable, permanent supportive housing and shelter services all on one site. So we began researching ways to track social determinants of health and how to link our services to them and the differences that they had on our tenants. And then in the summer of 2019, we started an internal task force to develop strategies to really help us build and sustain program capacity, develop different evaluation metrics, and strengthen partnerships with our Medicaid agencies and other community partners to address the social determinants of health for every client we served. So the task force was really focused on answering two questions. How do we facilitate cross-program services and improve our clients' journey? And how do we increase revenue to reduce those gaps in funding and improve services? So part of this conversation really included developing an internal referral system at a new leaf. So when the opportunity arose for us in the spring of 2020, we jumped at participating in the community information sessions hosted by Access. These were focused on what it would take for community behavioral health or community-based organizations to accept referrals from healthcare organizations, and was part of Access's Whole Person Care initiative. In late 2020, we also participated in a task force with Contexture to search and identify a technology vendor. And this was also as part of the Whole Person Care initiative strategy. And when the platform was identified, we participated in 2021 as one of the early adapters with NowPow for CommunityCares. And as we finished that pilot, or was working in that pilot, Unitas acquired NowPow, and at the same time, Contexture acquired HealthCurrent, and that was put on hold for a little while they worked through their relationship. And we decided to continue to participate in NowPow in a limited capacity so that we could gain from our experience in using the system. And we launched across all of our programs, or most of them, at a new leaf in January of 2023 on Unitas. We onboarded 34 different programs at one time. I'm excited to say we're actually adding another piece of this timeline where we have just added a workforce management dashboard that will help us. It's kind of another step in our journey to help us assist us in determining areas of improvement on an individual and program level. And just after 1 month, we've already been able to identify ways to improve our referral quality. And through staff training, we've been able to lower the percentage of our avoidable referral rejections for those referrals that we do send. So we are sending and receiving referrals across the agency in all of our different programs. Next slide. Okay. We wanted to share a little bit about what we learned from our journey with the early adapter program, and the steps that we felt were important for the implementation of CommunityCares in the Unitas platform. So we added CommunityCares goals as part of our current strategic plan. And then we really learned from our experience as an early adapter and applied that in our implementation with Unitas. And we also did a SWOT analysis with our staff at the end of using NowPow before we switched over to Unitas. And that helped us identify the strengths, weaknesses, opportunities, and threats in our implementation. And the biggest areas that we identified were focused around staff training. We also identified who was not consistently using the system, who needed a little bit more training, and what areas they needed to be trained on. It also helped highlight some areas that made our referral sending and receiving difficult, so that we could consider all of those when we identified our configuration, which also included 2 separate organizations. We built out a new leaf as 2 different organizations because we wanted to keep our domestic violence and sexual violence services and our behavioral health services a little bit different for confidentiality reasons. And we also had to consider different funding source requirements in doing that. We also created a super user group, and this group is really meets on a regular basis and is made up of all the staff that are responsible for training and supporting their team. As you can imagine, when we onboarded all 34 programs, we had over 80 case managers, and there was just 2 of us that were supporting the implementation without the super user group. We also chose to make participation a requirement for all of our identified programs. And what that means is that the staff that are responsible for sending or receiving referrals are required to use CommunityCares in order to do that. And then lastly on here, but also very important, is communication. We consistently share that we are participating in community cares with all of our staff and our community when we can. What staff roles are and any information relevant to their role. And we do this agency-wide internally. We present in meetings and put information on our SharePoint to keep staff engaged and up to date. And next slide. I was asked to share a little bit of our challenges. And although this is pretty self-explanatory, I wanted to just highlight a few things. You'll see the word opportunity on there, and I think it's important that we look at every challenge as an opportunity for change. So some of the areas that we've struggled a little bit with is funding, but the funding is needed to support increased referrals and staff time. As a nonprofit, sometimes that can be challenging. We also have a lot of duplicate data entry. So staff have to enter into multiple programs or platforms, Apricot, NextGen, HMIS, now Unite Us. And so finding an opportunity in that to reduce the duplicate data entry, capacity with our staff time and the amount of staff needed to send and receive referrals. Any restrictions sometimes that we have placed upon us by funders, such as we can only accept certain types of service referrals through a certain process, so they're not in community cares yet, or we can only serve a certain geographical area. And we also have multiple screening tools that are required. So we use SDOH tool where we can and would like to implement that agency-wide, and currently that's just in our behavioral health programs because of different screening tool requirements that we do have. And then I think what the other thing that I would like to point out is just we strongly believe that full statewide participation is needed. And when we started the pilot, we were one of the there was a handful of organizations that was on the platform at the time. And as being one of the first agencies that onboarded in 23, the feedback from staff was just, it works more when we have more agencies in the platform. And so I don't believe CommunityCares can meet its promise to be a game changer without full participation. And we'd like to support that as much as possible and sharing that information with our other community partners out there. And then really accountability has been a challenge too, in getting all the staff to log in when needed. We've added goals to their annual performance reviews and obtained the workforce management dashboard and tried to address those different challenges as they've come up. Next slide. So understanding roles has actually been something that we've had a lot of communication focused on, because there's been a lot of communication or confusion, I guess, around the different roles and relationships in our organization. And this includes staff roles and our partner roles. Sharing that information has really helped with staff engagement, because it's really important that everyone understands what CommunityCares is and everyone's role in it. And so we have, our confusion has been mostly around the different tying CommunityCares with Contextual Unitas and Access and everybody's roles, but also the staff roles that I add a new leaf. We believe everybody has a role within CommunityCares. And so that whether that role supporting the implementation of the technology or being a super user, responsible by identifying each of these different roles and sharing what that means, it's been able to help increase our engagement and support of each other for using the system or the platform. Next. Thank you. I wanted to highlight some of our favorite things that we found in using CommunityCares program with Unitas. Communication has really improved across our programs. We have a lot of programs at A New Leaf were spread over the valley, and having a singular platform for our referrals has been a huge benefit for sending and receiving referrals. Also access to care, it's really improved our access to our clients. We love the ability to be able to text some information through the platform and then build some more strong relationships with our partners. You were able to see the dashboards earlier, and we feel that the dashboards are really important and provide information for us to improve our referral system. And then collaboration has also, there's been an opportunity to collaborate more with other service providers. And we welcome collaboration with our healthcare providers and plans. And we mentioned earlier the incentives as well. And the system features that have really standed out to us is sending multiple referrals at one time has actually saved on staff time. And then again, sending information directly to the client's phone and being able to manage our referral volume by some of our services are based on our funding. And so when the funding ends, we're not able to provide that service anymore, and we can turn the referrals on or off based on what our funding is. And then some of the things with the dashboards, if you remember, was just receiving the organization, knowing what the top 10 sending or receiving organizations are, being able to see what our reasons for rejection are, or what referrals might be recalled, accepted, and what types of referrals those are. And the next slide, I think we're in. Thank you so much. I hope that information was helpful from a community-based organization perspective.
Thank you so much, Karen. I think it was incredibly helpful. I'll invite all of our panelists to come back on video for some Q&A. And for all of our attendees, as a reminder, you can put any questions you have in the Q&A box and we'll pull them forward. There was one that was in there previously that Julia answered, but in case y'all didn't get a chance to see it, the CommunityCares platform is available for all people in Arizona. It's not just for Access members. You can refer anybody through the platform, whether or not they're an Access member, which is such a great opportunity for us to be able to, as a whole community, support Arizona and supporting social determinants of health. Karen, I loved the information that you provided in there too about how you stood up your program, because I think sometimes that's the hardest thing, is getting started, and what does it take to get started. So that was really insightful too. I think I'll start with a question for all of you, and curious about how this work through CommunityCares has enhanced your relationships with other organizations in the community. Have you seen an impact there in partnerships across providers and community organizations?
I would say that we have seen an impact because we have the ability to communicate case manager to case manager through the platform. That's helped build relationships. And it's also helped us be able to educate each other more on our services at different organizations, which has made our referrals stronger, more quality.
Sure. From our perspective, we have found some really spectacular community agencies. At this time, we are not bi-directional, so we're not receiving referrals from other agencies. So I think that natural organic partnership has not really happened that way for us, probably until we are bi-directional. But again, we've found some really outstanding community partners that we then connect with, have meetings with. How do we best refer to them? They often have guidance on how successful referral can be made, and that's where that information goes to Sam to enhance the referrals that we send outbound.
I'll just add one of the upcoming next steps for CommunityCares is really engaging partners together and sharing best practices from our partners as the experts and super users of the platform. And so stakeholder engagement groups will be coming out here in the next 2 quarters.
Wonderful. Thank you, Kelly. And then I'll pose this one to you as well, Kelly. Does CommunityCares have a mechanism to let providers know when a particular resource isn't available, or maybe it's too far away geographically based on where that individual lives? And then are there steps you take based on learning that information?
Yeah, so the platform has functionality that when you are going to send a referral for a patient, it actually populates resources closest to the patient's address. So, and then, you can filter that as you might want to, whether that is to your organization. If the client or patient has unstable housing, you can also, filter it appropriately to really meet the needs of that client. And then regarding, updates on the referrals and resources, so as a referral sender and receiver, you really are able to engage and communicate across. So, as a provider, I could reach out and say, hey, what is an update? But also the platform has the functionality to provide those updates automatically. And so you will receive an update whether that referral was accepted or rejected. If it's rejected, you then have an opportunity to resend the referral to a different organization. And then I do want to point out, Karen mentioned the ability to send multiple referrals at one time. And so you can send what we call a batch referral. And, let's say a client needs a food resource, and there are 3 resources that might fit the needs of that client. You can actually send the referral to all 3 of those organizations. And the first organization to accept the referral will then be able to provide that service. And the referral to the other remaining organizations will automatically be recalled.
Great. Thank you, Kelly. Julia, Samantha, Karen, have you had any feedback from patients or clients regarding their ability to connect to resources through the work that you've done through CommunityCares, the referral platform, like any of those success stories directly from the folks that we're serving?
I do not at this time yet, because I don't think they're using. I've had feedback from those that might receive information on their phone when we're able to text it to them, but otherwise they're not sure of the whole mechanism behind everything. They're giving permission, of course, for us to be able to use the system, but they're not seeing that impact on them directly.
I think from our perspective, to make this successful and sustainable, we've really pulled out our embedded care navigators and referral coordinators that are inside the clinic that probably have that more face-to-face relationship, and moved this work kind of out of the clinic setting so we can have that bigger control. So sorry, my auto light, it has a mind of its own. So we probably don't have the access to those success stories. However, we do know that some of our families coming from our primary care settings, they have expressed like, hey, I got someone reached out to me and was able to get me, access to diapers, or the Crane Community Foundation. I'm on their weekly list to pick up food. So I think we're going to start to see a lot of those great success stories come back to the practitioners who have that more immediate relationship with our families.
Wonderful, thank you. Kelly, I see you're actively typing an answer too, but I'm wondering if you might be able to share, for those who aren't actively engaged in CommunityCares right now, what's the best place for them to learn more about how to either onboard with the platform or get more comfortable with using it? Just if you can remind folks on those resources.
Yeah, so again, I think we included the link in the chat. We invite you all to come to a CommunityCares information session. It's a virtual session that does an overview, a more in-depth overview than what I provided today, reviews the onboarding process, and then we'll do a platform demonstration of the functionality. So I would encourage you to join one of those. From there, we will have a teammate reach out to you to determine what the best next steps are. And then you will have individualized support throughout the onboarding, training, and then post-live as well.
Thank you. That's what Kelly mentioned, that the personalized onboarding and answering questions and setting things up was really, really helpful. And I and a colleague, as we went through this experience, it was really nice to have those touch points and that real personalized touch and their commitment to us to meet monthly since go live. So thanks, Kelly.
Yeah, no, thank you for saying that. Really, our goal and our perspective is CommunityCares is a tool that's here to support the work that you all are doing, the incredible work that you got to hear about today. And so we really try to sit down and identify how can CommunityCares work best into your workflow, your day-to-day, and then we'll configure and set up the workflow and organization appropriately to your individualized workflow.
Thank you so much. I would invite our panelists to share any closing comments that you might have, or like last thoughts that you would like to share with the audience before I wrap us up here for the day. Karen, I'll start with you.
Oh my, well, I would say it's been a great experience for a new leaf to go through CommunityCares and participate from the very beginning. I really encourage everybody to get on board. I think this is a great opportunity for our community to improve the health of all those that we serve and partner together to do that. And I welcome more partnerships to come through this. Thank you, everyone.
Thank you, Karen. Julia?
Yeah, I echo what Karen has shared, is that really the success of this platform and supporting Arizona will take all of us, a commitment from everyone to be involved and make this a robust platform that will be able to grow and support all of the different needs. Like each of us has a different focus. We're very pediatric, like child focused, but right, we have our veterans, we have our families experiencing homelessness. It's so wide, the needs, that the more we all can commit to using this will lead to the success. And I will also thank Access for allowing that differential adjusted payment, because that's what's going to help allow us to be sustainable and to allow us to hire staff that are dedicated to this and bring on more Samantha Pearsons in our future.
Thank you, Julia. Kelly?
Thank you. Just thank you so much for the opportunity to speak with you all today. And thank you so much, Julia, Samantha, and Karen, for joining and sharing your experience. As I mentioned, CommunityCares is really meant to be a tool to support you all in connecting Arizonans across organizations, across sectors. And so, as Karen mentioned, it really, we will not be able to see the full impact until we have partners join and support and start to share their data across the system. The goal is, of course, to connect Arizonans and address those social determinants of health. And then lastly, we want to hear from you to understand how CommunityCares can improve. And so please reach out to us.
Wonderful. Thank you, Kelly, Julia, Samantha, Karen, for all of your insights and the work you do every day to support Arizonans. It's so important, and we appreciate you being willing to share in this broader forum. For those of you still in attendance, we'll be sending out additional information, and you can see the QR code on the screen for the survey that will get you over to your CEUs. We're going to be taking a hiatus over the summer. We'll return in a couple of months with more Arizona Community Grand Round sessions, so please stay tuned for that, and we hope you all have a wonderful week. Thank you so much.